Well, I want to thank all of you for joining us in our third series of Fireside chats. And today's topic is workers and safety. Joining us today is Ralph Mecheau, liquor store clerk, works in one of the highway stores. Kenneth Muskey, who works for unemployment security and is an insurance interviewer from that department. And Senate President Donna Soucy is joining us on this call as well. Both Ralph and Ken are state employees and have witnessed some significant safety concerns during this COVID-19 pandemic, and we'd like to share their stories with you. So with that, I'm going to start with Ralph, and why don't you tell me a little bit what's going on at Liquor?
There's people coming in that are from Massachusetts and other places that aren't self-quarantining and wearing masks during when they come in. So that's one of our first concerns. We've also picked up doing curbside service, and that curbside service is basically we're going out and putting things in people's cars, and they haven't prepped their cars to accept or receive the resources that they're buying. So sometimes we have to move their luggage. We have to get inside just about, which defeats the curbside service in a way. It would be much better. We've got to make some way of letting people know that they need to have a space that's cleared so that we can actively put the product in, or else we need to roll it out, set it beside the car, and let them put it in themselves. So those are two issues that I've talked with people about within the stores. And the third one has to do with part-time employees. And I'm just going to throw this one out there because we know that there's a number of them are feeling as if they're on medical notes to be out of work, and they feel that they're being pressured by our HR to come back. A lot of these people, myself included, we have high morbidity rates where we have COPD, you have people with diabetes, high blood pressure, and basically they've been told that they'll be taken off of the First New Hampshire system or payroll, and if they don't return by a certain date or give a date certain that they will return. And as we know, this thing has been consistently moving, so you can't give a date necessarily certain that you'll return, and the doctors are not giving notes certain of the day to return. So that seems really unfair, and it also seems a little bit, in my mind, poor business judgment to take them off the rolls when you have 13 stores that are not open because they can't staff them.
I have a hard time understanding why you would be forcing out some of your workforce when you don't have enough workforce to open all of your stores. I think that's a further question that we need to answer within the agency. Ralph, I want to thank you for sharing that with us. Ken, I'd like to turn it over to you now. Employment security has seen an explosion in unemployment claims these past couple of months. And what are you experiencing there? And what are your coworkers experiencing?
Well, we're working 12-hour days here during the week and 9 to 5 on Saturdays and Sundays. So we've been pretty busy for the last 3 months. We've been thrown at the problem. Basically, there's a problem, so they threw people at it. We're the people that are stuck with that. We tried to address it a little bit before the lockdown and asked for a safety committee meeting. I'm part of the safety committee. That's a meeting of labor and management that looks at, addresses safety and welfare of employee issues. And they chose not to do it, even though the contract calls for them to hold one within 10 days of us requesting one, or them requesting one. They ignored it and wouldn't do one. They have a real lawyerly response that, oh, they've talked to the president of the union 3 times and some of the people 3 times, but that's not the safety committee. It's not what's in the contract even. And some of the issues of safety that we would have addressed with the people that are on the safety committee weren't addressed. Something as simple as we're running a call center with no headsets. So we have people holding a phone between their shoulder and their ear. So there's going to be a whole series of workers' comp claims after this is over, because if you do that for about 3 months, you're going to have problems with your neck, your back. So the force is pretty beat down and worn down. We need to schedule some significant downtime to rehab the folk. Everybody is just really tired, and they've done magically with keeping things going and getting claims in with all of it. So, you know, it's something that we need to do. We also need to look at working from home. I know that Health and Human Services have a significant part of their workforce is working from home, and they're much larger than we are, but it's always said, no, we're not going to do it. We can't have the throughput here. Well, we've got people at home now that could work and could carry some of this load, but they're not allowed to do it. They just won't do it. They basically consider us machine parts to throw at it, but even machine parts have planned maintenance. So it's getting pretty rugged here. Everything pretty much comes top down directive. We aren't consulted about anything. We're just expected to be on the phones continuously. And unfortunately, there are people with 7, 8, 9, and 10 weeks of claims and haven't been paid yet. And we're the ones that have to work with them. And the system is having a problem. It's pretty beat up. I'm amazed it's still running. And that has to do with our IT folk are doing Herculean jobs to keep it going.
Senator, I think we're really concerned not only about the physical safety, but the mental safety of the workforce too, as you can imagine, as this goes on. And, you know, as Ken points out, I don't think that seems to be falling on deaf ears, is the mental safety of our employees as well. But you care to share any thoughts on what you've just heard?
Sure. Ken and Ralph, first of all, let me say thank you. Thank you so much for continuing to pull through, for the great work that you're doing, but for also continuing to raise important concerns about safety for yourselves, your fellow employees. That's really critical. I think what struck me the most about both of your concerns is the inconsistencies that we have within state government and how we're applying those. Some agencies are able to work from home more easily. Understandably, that may be the case, but it sounds like an inconsistency in the application of those policies. Also struck me that we are in the process of working towards starting to reopen businesses and are really being very diligent about establishing procedures and protocols to maintain safety, how people can, for example, get their hair cut again, and requiring people to wear masks and trying to make things available. And yet we seem within our own liquor stores to have an inconsistency in the application. So if we're trying to preach to or encourage the public as a whole to be safe, not just for themselves, but to those that they may expose themselves to, whether they're symptomatic or not, we need to be consistent and we need to be leading by example within the state of New Hampshire. So when we're doing things like retail, we need to hold ourselves to not only the same standard, but I think a higher standard than we do the businesses that are reopening. And with regard to the long hours at Employment Security, I am glad there are other agencies that have volunteered staff, but I think we need to do more of that because, as you said, Ken, and I appreciate your concern, people really are relying on being able to obtain those unemployment benefits and have gone weeks, particularly the self-employed have had some particular challenges, I think, trying to get their benefits added to them. And I appreciate your diligence. I appreciate your caring and recognizing that you're really the ones on the front lines for them. Look, as I said, we have an obligation. If we're going to start to reopen the economy, we need to do it by leading by example. And we need to put in place practices for our employees that are as good, if not better, than the practices we encourage private businesses to employ and adopt. So we are going to be meeting in session. You see the Senate chamber behind me in the coming weeks. And I know that workplace safety is a very important concern for both the Senate and the House. And we want to make sure that we are taking care of employees, that we are recognizing the differences in people's status and conditions, and that we're finding safe and reasonable ways to help people re-enter the workforce and manage their work days as best they can. But most importantly, I do want to say thank you to both of you gentlemen for your devotion to your work and your fellow employees.
Thank you, Senator. Ken and Ralph, you both shared a lot with us on this call about your experiences and your fellow workers' experiences. If you could, I'm wondering, you could speak directly to Governor Sununu right now. What would you say to him?
That's a tall question. Okay, there's a lot of things that I would say to him. I suspect one of them would have to do with the contract, which I've said before. You know, we have people out there, clearly you understand the dedication that are there with our people. You know, and I think that they're being played because they are dedicated. You know, if state employees were not there at this point in time handling the ball, these things would fall by the wayside. So if you're going to do something, Governor, sign the damn contract.
Thank you, Ralph. Ken?
Well, if I was talking to Governor Sununu, I'd say, Governor Sununu, your workers are doing heroic work here. They're achieving wonders in spite of a lack of collaboration from management that we work with. And we don't need to be told, given excuses every time we bring something up or try to do what the contract calls for, have our safety meeting. You know, basically they're in abeyance of the contract. So like Ralph says, sign the contract and tell your people to adhere to it. Work with us. We're here to work with you. We don't want to be opposing you. And I spend most of my time convincing people as a steward to continue working because the people of the state do need us and it matters.
Yes. Yes, we're all on the same team. Senator, I know from time to time you do get a chance to meet with the governor, and if you could share some of these stories with him, we would certainly appreciate that. For whatever reason, he doesn't want to talk to us. Being the CEO of the largest employer in the state, you'd think he would, but we are on the same team. Well said, Ken. I'd like to thank the three of you for joining us today and getting this important information to the public to hear our perspectives. Because so much of the news coverage doesn't highlight these problems. For those of you watching, please comment below on your thoughts about how the state is handling the many safety issues that have arisen during the pandemic. And I want to thank all of you again, and I think that wraps it up for today. Be safe out there. Thank you.
Thanks.
Thank you.